Welcome to another episode of HealthTech with Purpose podcast, where we dive into the world of men's health today with Reza Amin, founder and CEO of Bastion Health. Reza's journey began when he embarked on his fertility journey and discovered a glaring gap in men's reproductive health technology. Motivated by the need for accessible solutions, he founded Bastion Health to empower men to take charge of their health from the comfort of their homes. Join us as we explore the innovative telehealth platform offered by Bastion Health, providing personalized care for men's prostate and reproductive health. Together, let's revolutionize men's health technology and pave the way for a healthier future. Hello, Reza. Welcome to Health Tech with Purpose podcast. Hope you are doing great. It's an honor and pleasure to be hosting you because you're doing some fantastic work in men's health, which is one of the less talked topic usually. So I'm really excited, looking forward to this recording. And for our audience, why not you go ahead and provide us a quick pitch about the work that Bastian is doing.
Yeah, thank you so much, Ayush, for having me. Um, little bit give I'm going to give a little bit background about myself and then a little bit background about the company. I did my PhD in medical device health technology, and before Bastion Health, I co-founded another company called Encapsulate, which is a cancer precision diagnostic and therapeutics company. Um, in Encapsulate, we are launching cancer studies in space in collaboration with NASA and International Space Station. And the purpose of those studies were to learn more about how we can do more prediction and defining which chemotherapy options are the best for patients. And we have designed our solution in a way that we can apply it on the ground, and that was basically the purpose of all these research. But then I started Bastion Health, and the main goal of starting Bastion Health was because there is this huge gap. I personally have gone through fertility journey. I lost my grandfather to prostate cancer, and there's also a personal reason behind starting Bastion Health. But in general, there's this huge gap in men's healthcare, and at Bastion, we wanted to redesign the healthcare for men in a way that it's more modernized. It's designed for 21st century. And with that, basically, we wanted to engage men from the comfort of their home. So we invested a lot in designing a technology that helps engaging men using their mobile phone application. We have focused on designing hardware technology so they can do the testing required for diagnosis from the comfort of their home. And we designed the experience and journey very seamless. So from the first conversation with our care coordinator and health coach to the conversation with nurse practitioners and having the test kits and talking to urologists as a specialist and receiving the treatment they want and walking them through the treatment, we wanted to make sure everything is designed around our users, which are men, and engage them more in their healthcare. So today at Bastion, we're covering prostate, reproductive health, sexual health, and hormonal health. And recently we added our cancer screenings as well to our program. With that, mission is to make healthcare accessible, affordable, and improving outcome for employers as the payers and health plans as the payers, and also for patients to make sure that they are on the top of their health.
Nice. And all of these solutions, are they offline? Are they in person, or are they both? Can you share more about the model of delivery? And also, like, what is the scale of the impact that you are creating today?
Yeah, thank you so much for that. So Bastion is completely virtual specialty digital clinic. In fact, we are the first and most complete specialty digital clinic for men in the US. And we have designed our solution in a way that we can engage men from the comfort of their home. Everything is designed so that we can do from the visits to the at-home diagnostics to receiving the treatment. The only time they need to basically go out is when they are going to their pharmacy to pick up their prescription. When it comes to the scale, we are now live in around 44 states in the United States with more than 60 urologists and nurse practitioners. And we basically made sure that we cover around 93% of U.S. population, which covers basically a big portion of the country and also the workforce of the country.
Great. And are you integrated with payers and providers, or like how's the ecosystem set up?
So Bastion is a technology company and a provider company. So we have our medical practices, and all of our providers are providing care on the Bastion umbrella. But we are partnering with payers. So we're partnering with self-insured employers as the payers, and also with health plans. And we are integrated with some of large health plans of the country.
Okay, that's fantastic. Great. So there's a tell us more about the journey, especially looking back. What were some of the revelations that you saw as you built Bastion, and let's say some of the assumptions that went wrong, for example. Those are always interesting to learn.
Yeah, so as you know, healthcare in US is a very complex environment. If you are coming to healthcare just considering that as a technology problem to solve, you're failing. And there have been a lot of examples. Very big technology companies started building solutions for healthcare, and there are a lot of examples that they failed. In the news, you've heard a lot about all those failures with very large corporates. So that made it more and more obvious that there is a need to have a good understanding. However, we need to leverage technology, but we need to have a good understanding on how healthcare works. And one of the components there is to make sure that any solution that we are designing is well integrated. And without having that integration, it's a little bit difficult to basically design a solution which really add impact to the population and to the healthcare. And a lot of time, like I'd seen a lot of startups, including us, which we wanted to make sure that we design our solution step by step. And more, what we learn is that we need to be really comprehensive, horizontally and vertically, and connect to all the players in the healthcare space in order to be more effective. So it took us some time to build the technology. Today, we are connected to all labs, pharmacies, clinical setups in order to refer our patient out, in order to design the technology, in order to make sure it's scalable, in order to design our hardware technologies to make sure that we can do all the diagnosis that's required in order for our physicians to make the decision from the comfort of their home. So the whole sort of like scope very initially, when I'm thinking back, was a little bit more simplified than what we have today. And what we learn more and more, however, is good to simplify. And as Albert Einstein said, make it simple, but not simpler. We should not make it very simple, because in healthcare, if you make it very simple, then you are missing the sort of like main building block of the system. And that's something that the current healthcare setup cannot afford. We can't afford more solutions that add to the more fragmentation of care in the country. So there are a lot of solutions now in the market which you use them, and then when you want to get your medical history, you can't share that with your doctors. And all these fragmentation ended up sort of adding more problems to the system than solving for the good of the system.
Right. No, definitely makes sense, and pretty much like every bit of it seems so true. Unfortunately or fortunately. So there's a one other thing that I like to point out is, one of the posts, in fact, that you had shared on LinkedIn earlier was that 1 in 2 men are at the risk of cancer diagnosis, and there's 150% higher likelihood in today's world. Alarmingly, 55% of men do not engage with current screening methods, resulting in late stage diagnosis and skyrocketing healthcare costs. So, what's the solution to this scenario? And in other words, I'm also curious to know why men's health does not get as much attention today as we hear more and more talk about women's health and innovation happening there, which is fantastic. But I do not see as much coverage or talk about men's health. So, what have you seen? What as a first person working in this field? Yeah, what do you see?
So, yeah, there are some alarming statistics. You mentioned some of them. Um, in 2023, over 85 million men in the US voiced concerns about cancer, reproductive health, and sexual health. And more than 55% of them did not engage in the current healthcare setup. And that's mostly because of the lack of convenience, lack of access, fragmentation, the stigma behind it. And in general, men are not engaging as like women in the current healthcare setup. So we need to design for a solution which help engaging them to make sure that we can improve their health. And as you have seen some other reports that are showing that the gender gap of life expectancy is increased in the past 30 years, which, initially we had a lot of good progress, but in the last 3 years, unfortunately, that gap increased again. So there is a big, I think, gap and lack of access, which needs to be solved, and also lack of experience. The user experience of today's men's healthcare is broken, especially when it comes to anything under the belt. So we need to redesign it around our users. That's user experience design 101, which we need to apply in the healthcare to make sure that we can engage men, have them be on the top of their health. And at Bastion, we have proven that we can engage men more when we are offering the solution to men in the comfort of their home, and they are engaging. And a lot of time, not engaging in one of the health conditions they have. In average, we have seen that they are engaging with 3 of our programs, which basically helps them more comprehensively improve their health. So I think the notion of the fact that men are not engaging is debunked by, and I think it needs to be rephrased to men are engaging when the solution is designed around them, and as a user, they deserve to have a solution designed for them. But to address your second half of the question on why there is not a lot of attention to men's healthcare, I think this is a fair question to ask. There have been a lot of technology solutions in the past 6 or 7 years designed for men's healthcare, but majority of them, and I'm going to give some examples here, are focused on low-hanging fruit and sort of like conditions that are not really serious conditions in men's health. So there are a lot of solutions designed for hair loss or erectile dysfunction, which is part of the healthcare.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
But erection is not the only problem that men have. So there are other comprehensive and more important preventative care that we need to provide to men. And if our solution is not really comprehensive, and again, back to the integration, if that's not integrated, we can't really solve for a problem, solve for this problem to basically improve the access, improve the affordability, the outcome, and eventually saving costs for the healthcare. I think more and more we are seeing companies, and as the women's healthcare space reaching to a maturity, there are a lot of new technologies that are learning from women's health technology solutions to apply to men's healthcare, because eventually men's healthcare, we don't have anything like men versus women's healthcare. Both men health and women's health is family health. And in order to have a healthy family, both men and women need to be healthier. In fact, we have seen a lot of women, which usually they are the chief medical officers of home, setting appointment on our platform for men. So we know that there is a lot of burden on women when men are not healthy. So I think in general that we need to make sure that we see both men's health and women's health as a family health, and make sure we design our solution in order to have a healthier family.
Mhm. Makes sense. Makes sense. In fact, that brings me, to ask you to go deeper a bit into some of the keywords that you use, which is related to stigma, engagement. That is a bit that makes men, for example, lagging, for example, towards health. So, is this, let's say, how can this problem be solved, basically? So, is this a technology problem? Is it a societal problem? Is it a access problem, or all of it? Can there be better systems designed? Probably you are already solving that. So, please tell us more about that.
So as a technologist and designers, and based on the user experience 101, we never can blame users. So in this case, men as a user, they have a need. We know that they have concerns about their health. They are engaging when we design it around them. We just need to sit down and design and redesign, actually, or sometimes we need to break it apart and redesign it again. So in order to improve engagement, in order to deal with the stigma, I want to give you a few examples here. I personally have gone through a fertility journey. As a man, when you go through that journey, the experience is broken. You go to a cold room, you receive the sort of a cup and a magazine. You need to collect sample in that cold room, hand it to a nurse, and then they're going to do the analysis. Then you need to go to a urologist. There are a lot of fragmentation and steps in order to get simply the diagnosis you need. And then you need to start the treatment and repeat that process again and again. So I think it's reasonable if our users are not engaging as good in the current setup, because it's not really convenient, and they feel like it's not really designed for them. Same thing happens to prostate screening. When it comes to prostate cancer screening, the first thing that everything, and I think it's also in the pop culture, the first thing that you think of is that you're going to have a prostate exam, which is definitely not something that all men are willing to do. And in fact, there are sort of statistics that shows a lot of men are skipping that just because they are not comfortable to do that. And of course, we need to redesign around them again. There are many new technologies already developed that we can leverage in order to have them get the screening they need using a few drops of blood, or using imaging solutions, and also having a clinical protocol which is defendable, which increase outcome compared to some of the sort of like traditional screening tools that we had, which again were not really a user-friendly tool. So we need to basically go to our toolbox and redesign. I think that's my short answer to what you're saying. If we don't break this apart and redesign it again, we are going to have a lot of bumps in front of our users, and then of course we can't blame our user.
Right. Wisely said. No, definitely. This is a long, of course, holistic journey that needs to be created to create that environment. So, Reza, tell us more about, so which all locations, Bastion currently is, active. Where are your offices, and are you only in the US, or are you also expanding to other geographies?
Today, Bastion is only in US. We are live in 44 states in United States, and we're expanding to 50 states.
Okay.
But the focus so far was in the US market and designing our solution comprehensively and again vertically in this market. Of course, in future, as we grow in US, we're going to think about other markets as well. Our team is remote. The whole sort of like a structure of the company is designed in a way to be a company for 21st century, the experience for 21st century, and making sure that we can provide solutions in a high quality to our customers and clients and our users eventually, which are our patients.
So another question, which was an interesting thing I found in your profile, Reza, was that you have been a serial founder. So you have launched another health company in the past, Encapsulate. So what were those lessons that you were able to bring when you started Bastion, your second journey? Because the context of this question is that some of the lessons that any other founder listening to this podcast can also learn. Maybe it's their first, but probably with your with the knowledge that you can share, they could use that as well.
Yeah, Rumi said, as you start to walk out on the way appears. So there are a lot of up and downs in the entrepreneur's journey, which a lot of time they get discouraged or they may lose focus. But I think the rule that I think applies to a lot of entrepreneurs in order to be successful is to make sure we design one step at a time, and as we walk, the way appears in front of us in order to reach to the success. We just need to be focused. We need to have the goal in mind, but then from that point on, solving one step at a time. For young entrepreneurs listening, I think we need to understand that there are steps in building a new successful solution, and we need to make sure that we are going through those steps, and that journey is well designed as an entrepreneur. So eventually, then your business be successful through that journey. And for any entrepreneur, so they usually go through the ideation phase and learning phase and execution phase and risking phase. And then at some point, they need to persist. Every single step needs to be taken very wisely because on the ideation step, you basically are looking for the solutions, and you need to be very smart in looking for the solutions that are really reasonable, doable, achievable, and have high impact. And then they need to learn a lot and be open to learn things that it might not be in their comfort zone. But then also iteration is important to make sure that if you learn and execute and it failed, you need to be open to pivot so quickly in order to rebuild that solution again and test it again. So that iterative way of design is very important. But eventually, you need to be a risk taker. I believe in these days, the risk of not taking risk is more than taking risk. As an entrepreneur, if you're taking a smart risk, I think that's the That's the key to building a successful company. For us, when we started focusing on men's healthcare, there were not a lot of companies in the men's healthcare space. We received a lot of comments that it would be hard to engage men, and then we definitely knew that there are some data that men are engaging less in the healthcare than women, but that basically is a problem that you have, and if you think thoroughly, you can design a solution for that, which we ended up knowing that there is a risk, but then if we take that a smart decision-making process and designing our solution in a way that basically address those risks, we can do some risk medications. And eventually, when you passed all those steps, it's very important to persist. It's going to be a roller coaster journey, and sometimes even more curvy, which you need to persist. And if you have taken those steps wisely and accurately, one step at a time, you can achieve your goal.
Great. No, that is definitely good wisdom. Of course, foundationally, we all know sometimes, but I think getting directly from a master who has done it, I think would reinforce that thought. So my last question to you, Reza, is some of the learnings that you do on an ongoing basis. So what are those audiobooks and podcasts and other channels that you highly recommend that you follow and have found really good? If you could share with others.
Yeah, there are. I mean, these days it's very. I'm very happy that we are living in this era, because the democratization of the information is really there, and you don't really need to have expensive subscription in these expensive sort of like news letters in order to get access to the news or new data. So these podcasts, and there are many of them, and I don't want to mention one or two names, but I want to make a recommendation about a book which I think every entrepreneur needs to know about, and it's called Crossing the Chasm. And that's very important for the tech entrepreneurs, because we are not initially designing our solution for the whole market. We're designing initially our solutions for the early adopters and those innovators in the market. When we are designing our solution, we need to know that not all the market is going to sort of like immediately adopt our solution. And that's natural for any technological sort of like innovation that has been introduced to the market. There is a path, and then the path is statistically now more clear. This book, which is called Crossing the Chasm, I recommend everyone to read it if you're building your company, because it shows you how to go from 0 to 1 and how you can pass the chasm in order to have a very successful company.
Great. Thank you so much, Reza. Thank you for the wisdom, and I'm definitely reading that one next. So thank you. Okay, great, Reza. It was an excellent talk with you, and I think there's a lot of takeaways, especially for anybody harboring into these less, I would say, less glamorous but equally important aspects of health and domain. So thank you so much, and I think speaking with you truly tells me why you deserve the 40 under 40 award that you recently received. So congratulations on that too.
Thank you so much, Ayush, and thanks for having me on this podcast, and excited to continue the conversations also, and seeing you in US when you are here.
Likewise.
Thank you. Bye-bye.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.